Hi, Nicola. So we're sitting here talking to Nicola Ware, the Chief Executive Officer of Ramsay Health Hospital Foundation. ANZUP and Ramsay Hospital Research Foundation is starting to strengthen our partnership together. Tell us a little bit more about RHRF.
Thanks, Sam. So RHRF was founded in 2017, and we've got a mission of improving outcomes for patients treated within Ramsay Healthcare. Ramsay has 73 hospitals around the country, and we operate a clinical trials network in 21 sites. And the aim of that clinical trials network is really to embed research within the private healthcare system and enable improved outcomes for our patients.
That's amazing. When did it start?
So it started in 2017. We were founded with a grant from the Paul Ramsay Foundation, and they were fortunate to receive $5 million a year to be able to give that funding back to doctors and researchers around Australia to support the research that we are trying to develop.
That's incredible. I mean, I know how important research is. I've been a medical researcher my entire career. It's absolutely so crucial to understand disease so that we can deliver better care to our patients. So what was the impetus to start the foundation, and how is it delivering on its mission?
Yeah, so as you know, Sam, when you have research embedded in a hospital, the outcomes are always better for patients. And so Ramsay's vision was to make sure that it had an embedded research system that was then positioned to translate research directly into health services. And the commitment from the managing director of Ramsay Healthcare is whenever RHRF funds a project and that project is shown to be successful and improves patient outcomes, we're going to translate those projects directly into Ramsay and into health services. And as I'm sure you know, the translation timeline for research is currently sitting at about 13 years, I think. So anything we can do to improve the translation of research and directly impact patients' lives is our mission.
So how much has Ramsay Hospital Research Foundation invested in research?
Since we've started, we've invested 29 million in research grants. I think that's around
That's amazing.
55 research projects, and we've had over 75 publications. And I think it's around 20 projects have now concluded, and we're actively exploring those for translation. But what we do is we partner with our doctors and public sites as well. So it's not only Ramsay Healthcare that benefits from this research. Core criteria for our grants is that it operates in a Ramsay hospital as well as a public hospital. And that way we hope we make sure we increase the reach of the research and we have the ability to impact patients' lives throughout the whole of the healthcare system in Australia.
That's incredible. So tell us a bit more about the sites across Australia that you have.
Yeah, so thanks. We've got 21 sites where we have this clinical trials network. It was one of the first things RHRF did, was found a clinical trials network with the theory of making sure the Ramsay hospitals where they were most likely to have research, we had the right infrastructure to do the research. So that clinical trials network has all of the physical infrastructure as well as highly trained individuals and clinical trial coordinators, research managers, statisticians, all of those sorts of things. Those sites there's 3 in Queensland, 4 or 5 in New South Wales, 2 in WA and 3 in Victoria. And we focus on oncology research, but also we have a strong network for mental health, orthopedics research, musculoskeletal and cardiology. And we're also growing in other areas like neurology, respiratory disease, ophthalmology, dermatology. And hopefully in 2026, we're going to set up a teletrials network as well, so we can do decentralized trials. And the ambition is that any patient coming through Ramsay is able to access a clinical trial.
That's incredible. And of course, teletrials are so important for delivering care to rural and remote communities and making sure that we see equity of access. So ANZUP Cancer Trials Group obviously have imperatives under the Cancer Australia infrastructure funding that we have to deliver that equitable access to clinical trials and world-class medical research across the country and into New Zealand. So speaking of oncology, and I see that you've got an incredible broad remit across your clinical trials sites, but we're here at the ANZUP 2025 annual scientific meeting, and we're talking about genitourinary cancers, bladder, kidney, testicular, penile, and prostate cancers. Now, Nicola, ANZUP and RHRF have been building and strengthening our partnership together. Let's talk about a very exciting trial that we have just opened together thanks to funding from Ramsay Hospital Research Foundation?
Yeah, so the Dara lipid study, the principal investigator is Lisa Horvath and Talia Scheinberg, and we're really excited by this study, particularly because it represents an opportunity to work with ANZUP, which is such a great collaborative clinical trials group. But also the investigators with this study have leveraged the funding. And so we've provided seed funding of $400,000. And then
Thank you.
and the investigators and working with ANZUP have managed to leverage that with Bayer and other organisations, which we think is absolutely amazing and actually represents what we're trying to do, to have those collaborative arrangements and offer investigators the opportunity to leverage funding and grow the funding base. So in addition to what we've done with Dara Lipid, we also fund collaborative research grants where the partners can go to NHMRC, ARC or other organisations to get that much funding.
Amazing. That co-funding model is really important when research funding is on a big squeeze and has been a big squeeze for many years. It's so important to be able to leverage that funding. So Daralipid is a trial led by ANZUP, thanks to funding we've received from Ramsay Hospital Research Foundation. We're really excited about this trial. So this is a trial that, it has been driven by an understanding of basic translational research that has led to potentially a really life-saving trial in the future. We're talking about patients with advanced prostate cancer who may be identified with a brand new blood-based test.
Yes.
To identify those patients who are most likely to do worse on androgen receptor pathway inhibitors. And in fact, we're going to combine two drugs to harness that. It's going to be a pretty exciting trial, isn't it?
It is. It's going to be great. And one of the reasons we love this study is because it's taking research and evidence that's been developed here in Australia and really looking at existing drugs and existing treatments and ways to do things differently, which for us is really exciting and absolutely meets our mission of improving patient outcomes.
That's right. And it's not a one-size-fits-all approach. You can take a patient population, most of them will respond to hormone therapy and some of them may not. And we think we can, by harnessing the understanding of disease, we think we can actually make those patients who are most likely not to respond.
And it's taking us down the pathway of cancer treatment, of personalised medicine. It's really designing something that's specific for a patient and a patient cohort, which is one of the things we're absolutely passionate about. And with the clinical trials network that we've got in place, we're really excited to be able to work with ANZUP and place the trial at some of the Ramsay hospitals. And hopefully we can help facilitate the trial and help you get patients on board as well.
Well, we're really excited, Nicola, and thank you so much for Ramsay Hospital Research Foundation's support for this trial. We couldn't do it without you. We can't wait to see the outcomes, and we hope that, it helps us on our vision of living life without fear of cancer. Thank you so much for your time. Thank you for your support. Look forward to working together in the future.
Thanks, Sam, and I can't wait to come back next year and hear about the results.
Thanks.
Thanks.